soldiers and civilians team up to treat trauma, and WIN supports the Georgia Army National Guard. This is the Regional Health Report. Welcome to the Regional Health Report for February. I'm Ann Krebs. Army medical professionals routinely treat trauma patients on the battlefield, and now there is a new program keeping them proficient at home.
5 Army medical professionals are the first participants in a program to help them sustain battlefield medical skills. Army military and civilian trauma team training at New Jersey's Cooper University Healthcare gives doctors and nurses real-world experience in advanced complex trauma, preparing them for deployment around the globe. The soldiers gain critical teamwork and technical trauma skills, working closely with their civilian counterparts.
The program is designed so that they will come here and work in a high-volume trauma center that has a large percentage of penetrating trauma in patients with a high injury severity score. So this is an experience that they wouldn't be able to partake in at a traditional military treatment facility.
Take the surgeon, the nurse, the medic, the operating room to the fight, rather than bring the fighter to the surgeon.
In our deployed environments today, I kind of have to be a little bit self-sufficient, and I have to have the broadest range of nursing skills possible so that whatever is going on with that patient, I'm ready for it. This is a great opportunity to do that because we have such sick patients here, and such a variety of patients, and just in such a rapid fire. So being the ER nurse, my role is going to be that first contact when the patient comes in, the first initial life-saving things that we need to be doing. So we've got our providers, our anesthesia person who's going to be doing airway and things like that. I'm going to be getting IVs, I'm going to be getting vital signs, I'm going to be making sure that we expose everything so that we can see all the injuries.
It's very quick, very fast. You don't know what's coming through the doors. It could be multiple gunshot wound victims, could be a multiple vehicle collision, and you could also have burn victims as well as medical patients that are severely ill all at the same time sometimes. I feel like this training will make me and has made me a better soldier as well as a better physician.
What's pretty unique about Cooper is the trauma ICU nurses also work in the trauma bay. And that's a component that most ICU nurses, although we learn about it, we don't actually get to do a lot of the resuscitation. When our skills transfer over into the deployed environment, we really need to be prepared to do the resuscitation in support of that line of care for our patients.
We would never think of taking your weapon to the battlefield without qualifying on the range, would we? We'd never do that. Nor would we want a nurse or an emergency physician or an anesthesiologist to go care for our wounded without being able to care for a wounded soldier who has been traumatically injured.
Cooper is our first, but it's the first of several in a plan to roll out where we partner across the United States with trauma centers that afford the similar opportunities that Cooper does.
Oregon Health and Science University is the second hospital to partner with the Army.
Over the next few years, the Army Medical Command will establish at least 10 trauma team training partnerships across the country. WIN Army Community Hospital provided support to a Georgia Army National Guard unit during a field training exercise at Fort Stewart. Zach Renstrom has the story.
The 48th Infantry Brigade Combat Team recently participated in a training designed to educate their soldiers on the utilization and implementation of the tactical communication and protective systems. The TCAPS is an advanced hearing apparatus designed to enhance communication and surveillance awareness while also providing incomparable auditory protection for the soldiers. Major Jennifer Notzel, U.S. Army Medical Department Activity, Fort Stewart audiologist and team lead for the Army Hearing Program at Fort Stewart, provided audiological support for this training.
As an audiologist, my focus is on the protection piece of it and making sure that they have the correct hearing acuity to be able to do the job that they have been assigned by the Army.
During the training, the MEDAC audiological team from WIN Army Community Hospital oversaw a regimented auditory screening process, which included a hearing test and device fitting. This testing process ensured that all soldiers are medically ready for deployment.
When you go downrange and something happens, we want to make sure you have the best hearing in that situation so that you can listen to your team leader and your squad leader and execute the commands that you're given. And we don't want you getting hearing loss back here because that's going to affect you out there. So if we can maintain and protect our soldiers here while they're training, then we're going to protect you down there and you're going to be ready to fight.
It was really important that we had this kind of hands-on training, the fact that we had all the support, and the fact that MedCom was listening to the fact that soldiers wanted something to this level.
The MEDAC team ensured each TCAPS unit was strategically placed to deliver optimum hearing acuity.
Readiness is having the right capabilities at the right time to do the right job. So for soldiers, we need to make sure that they have the correct hearing to do their job in whatever situation or environment that they're operating in.
MEDAC Fort Stewart's ability to provide this crucial service will ensure these soldiers are not only ready for the battlefield, but protected from dangers such as hearing loss. For Wynn Army Community Hospital Public Affairs, I'm Zach Renstrom.
In other news around the region, Keller Army Community Hospital received the Army Superior Unit Award. The award is given during peacetime to units that display outstanding meritorious performance of a difficult and challenging mission carried out under extraordinary circumstances. The award was presented by the West Point Superintendent. And from Fort Drum, New York, music is being used to help soldiers at the Warrior Transition Unit. Every week, a group meets to play guitar. Playing music helps with stress and anxiety. The group brings soldiers in similar situations together to heal. That's the Regional Health Report. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Flipboard, Pinterest, and YouTube. We're also on iTunes. Thanks for joining us.